everybody. I'm here with Dr. Downs. I've already introduced you guys to Dr. Downs a few weeks ago. Dr. Downs is a dental into revolutionizing sleep disorders with his partner.
Dr. Joseph Silk.
Oh, Dr. Downs, why do you think we have such a rise in sleep disorders?
It's been taking place, I think, mainly as a result of the modern society. People's lower faces are not developing to their genetic potential. There's all kinds of what is called epigenetic influences that are contributing to the underdevelopment of our genetic potential. And I think it's mainly due to our processed foods, the amount of sugar in the diet, the lack of chewing. It also has to do with many, at one time, and it seems like that's coming back now, lack of breastfeeding for babies. That is so important. It's a hard work to breastfeed for a child. They have to chew with their jaw vigorously. And it's very good for the development of the lower arch and the upper arch, and broadening and widening the face, and also opening up the airway and the nasal passages and posterior tongue area.
Got it. So
Yes.
outside of breastfeeding, how do we ensure that the baby's facial oral structures are properly developing? Let's say a mother cannot. And so what can we do at the beginning of somebody's life to at least minimize some of these potential risks that might show up a little later in life? What can parents do?
Well, first of all, if the child is unable to latch as they should, the first thing you should be checking is for tongue tether or tongue tie. Right. And also, there's also a lip tie up here and down here. That can also be contributing to their inability to latch. If those frenums are attached, and then it's a fairly simple procedure to go to a dentist and have that released with a laser or some type of other releasing procedure. And then generally that sometimes we see the baby able to latch right there at the dental office immediately after the procedure. It's pretty remarkable. So you want to be sure that there's not some kind of anatomical structure interfering with their ability to latch. If they still can't breastfeed, of course, you're going to have to use a bottle. Now, some people mistakenly take a bottle that has a small hole, and they actually widen the hole so that the milk will come out faster and feed the child quickly. That is not a good idea. They need to work at their ability to suckle. And sometimes you have nipples that are made flat like a breast would be, and those are good to use for a child to get a more natural suckling situation. I also think, though,
we're not making it hard for them. We're actually making the effort is actually in the suckling so that the facial structure can properly develop. We don't want to alter these things because it's convenient, right? Let's feed them much faster. They're suffering. No, they're not. They're actually doing what it's supposed to be happening. Right. That is
exactly right. May I call you Dr. Alex? Is that okay with you?
Absolutely.
Okay. So I would say that's exactly right. Now, when I was in dental school and we had our first baby, we had trouble. Tried for 2 months with suckling, and it just wasn't working well. So we went to the bottle, and I made the mistake, and my wife and I both, of opening the bottle up and making sure it fed faster. We didn't know any better. And so that's a problem. And of course, our children grew up with crowded teeth and smaller arches, which I had to try and correct with orthodontic care. And the problem with orthodontic care at that stage, dentists didn't know any better either, was they took out teeth to get the teeth lined up. That's now, I don't advocate that anymore at all, unless it's a second molar, which is the furthest back tooth. Um, Ordinarily, they take out teeth just behind the eye tooth, and then they make the arches smaller, but they line up the teeth. The teeth look pretty, but that is not good because it constricts the airway and this tongue space. Very bad idea. So I don't advocate that anymore at all. We want to expand the arches. Did I get off track there?
No, not at
Dr.
all. I
Alex?
think that is
Yeah.
awesome, actually,
Yeah.
information. I mean,
Okay.
I know that you are bringing out a program, like I said, that's going to revolutionize how we look at sleep disorders and what are some of the ways we can actually help overcome
Oh,
some of this. So why are you actually partnering with chiropractors to actually
well,
bring this revolutionized system out to the world?
that's a very good question, Dr. Alex. Okay. This is a multifaceted answer. Okay. Um, now I have sleep apnea. I had bicuspid extraction. I had narrow arches. I still have narrow arches, a high vault in my mouth, and I have sleep apnea, in which I wear an oral appliance every night to help me breathe. Um, didn't know any better when I had my orthodontics, but right now we can do these things, especially a pediatric person like yourself, Dr. Alex. Um, there was a device developed in Australia by a chiropractor. Okay,
Okay.
it's called the Maya Munchie. The Maya Munchie is a little device that noticed that it was starting to help broaden the arches of these children that were chewing on the device, and now it's developed into a product that you can administer to patients to help them develop these children's arches. So we highly advocate that. Now there's other kinds, there's MyoBrace, and there's other ones out there that do similar jobs. They work a little bit differently, but we do train chiropractors and dentists on how to use those devices. Okay, and so let me just tell you why I'm working with chiropractors. All right. The CDC has declared obstructive sleep apnea an epidemic,
Okay.
and it's largely an unrecognized epidemic. It is so bad. There's estimated to be 55 to 70 million people in America walking around with obstructive sleep apnea, and these people are getting heart disease and strokes and cancers and Alzheimer's disease and weight gain, and the children are having ADHD, uh, trouble learning in school. Their attention spans are decreased. They can't focus, and they're aggressive. And all of this is happening without being recognized by the medical profession, largely. It has been ignored. All they're doing is treating the heart disease, the cancers, and the strokes with expensive medical treatment after the fact, when they could have gotten to the source or a major source of these diseases, and they're not doing so. And if you do go into sleep medicine or get, as a patient, get into be tested for sleep, you go to a clinic, you lie there in a bed that's not your own, you're hooked up with all kinds of wires, and a very expensive sleep test is done. And that is taking a long time. Truckers can't do that. If they're trying to drive on the road, they lose their license while they're being tested. It's an antiquated, slow system. I'm not saying it's bad, because they do get quality information with those programs, but we need a more comprehensive approach, and we need to be testing more people. And dentists and chiropractors can test these patients, even if we don't treat them all. Because I screen for cancer and I don't treat for cancer. And there's nothing wrong with dentist screening for sleep apnea and not treating it, as long as we get them into the care system. But they at least need to be diagnosed and not misdiagnosed with heart disease and stroke and cancer and high blood pressure and diabetes. It's all being contributed to by this epidemic that is unrecognized. The CDC has recognized that it is unrecognized, and it's not being treated. It's probably the worst health program, health oversight in America, probably the worst, most serious problem that is untreated right now. Okay. And so I want chiropractors involved. They see lots of patients and they can screen them.
Absolutely.
And they're the better first choice to see than a dentist is on this program. I think so.
So last time we had a chance to kind of sit down and talk a little bit about this program. We talked a little bit about sympathetic dominance and how
Yes.
that in itself is a potential clue that we are again going down this path that could lead to numerous of other things, one of which is sleep disorder. So I told you last time we spoke that in my office we do a heart rate variability test which measures what is your sympathetic dominance or what is your autonomic balance like and stuff like that.
Yeah.
So can you talk a little bit about what is the role of that sympathetic dominance, that inability to adapt to stress, and again, the perception of we're being chased by a tiger all the time? What does that do to our physiology, and how's that bringing us down into some of these issues that we're trying to resolve before they become serious?
That's an extremely good question, Dr. Alex. When you're sleeping and your throat shuts off and you can't breathe, you're suffocating. Sleep apnea is really sleep suffocation. That's what it really is. So suffocating in your sleep is not a good thing. Your oxygen levels drop in your bloodstream. When that happens, your body becomes excited. I mean, it wakes up. You do not go into deep stages of sleep. You go into light stages, and you never get to deep stage sleep. And also the sympathetic system is activated because you're trying to survive. Your body wants to live. It doesn't want you to die. And the worst thing you could do to put yourself to sleep at night is to drink a bunch of alcohol, because that deadens your body's ability to save your life when you're suffocating. So don't do that. And it's probably the most often used drug for people to go to sleep, alcohol. It's the worst thing you can do. So we want to make sure that sympathetic system is not activated. You want to be in parasympathetic sleep, just like chiropractors want you to do. That is very important. So that's why the sympathetic system is set off. Now, once that happens, you also have a suppression of a hormone called ghrelin, and actually an increase of hormone called ghrelin and a decrease of leptin. So these cause weight gain, and the cortisol levels are also activated. So you have a constant weight gain that further exacerbates how bad your sleep apnea is. The more weight you gain, the more sleep apnea you have. It's a vicious cycle, and it's horrible. You can't lose weight. You can't get healthy if you are in constant suffocation mode while sleeping. Excuse me.
Yeah. That is. So one thing that I do understand is that you cannot truly have sleep apnea episodes at night unless you have some already noticeable differences in the breathing and the breath throughout the day. So what are some of the symptoms that one can actually notice throughout the day, or perhaps some of the screening tools we can use in order to validate a patient going through a sleep study?
Well, you really can't get a diagnosis of sleep apnea without a sleep study.
Okay.
We have a website now where you can order those and actually use the sleep study at home. One of them is so small it fits on one finger.
Okay.
And that's kind of nice. It's a very easy sleep apnea diagnosis, and it's FDA approved for diagnosing obstructive sleep apnea.
Okay.
We have other devices that are more sophisticated that give you more information. All of them can be ordered on that website, and anybody can order them. A patient can order them without the prescription of a doctor or the authorization of an insurance company. It is not an insurance-based site, but the costs are so low that it is inconsequential. Okay?
Absolutely. So last time we talked a little bit about the screening form that you do, And
Okay.
so I know in that screening form, the first thing that you have is if a person is snoring, that is
Yes.
a potential sign that we're
Yeah.
having some of the sleep apnea episodes. And then,
Yeah.
interestingly for me, because we see a lot of children with bedwetting that could potentially cause some
Mhm.
issues and
Yes,
have
sir.
some. So, talk to me a little bit about what are some of the
Mhm.
clinical signs
Okay.
and symptoms that
Okay.
one can actually kind of
Yeah.
check off and
Yeah.
really
No.
consider, are we really having the proper balance in the
Yeah.
nervous system?
Yeah.
Is our palate properly forming? And and
Mhm.
so what are some of the things that we can symptomologically say we
Mhm.
have an issue?
Well, one is if you see that in your mouth that your front teeth are very crowded, you can probably assume that your arches are narrow.
Okay.
And so orthodontics is not just for looks. Orthodontic care can be widening your whole arches and opening up space for your tongue so that it doesn't have to sit in the back of your mouth. But there is a thing called an Epworth sleepiness scale. The Epworth sleepiness scale is a measurement of how sleepy you are during the day. That scale is standardly accepted on most medical insurance plans. And one of them, the categories might be how likely are you to get drowsy in certain situations, like sitting and watching TV or riding for an hour in a car as a passenger. How often are you likely to get sleepy when you're actually sitting and talking to somebody?
Okay.
Um, there's these scores are listed from 1, 2, and 3, and you circle the likelihood, and then you total up the scores on these 6 or 7 questions. And if the score is 11 or higher, and then you're in a high degree of category that might suggest that you have obstructive sleep apnea.
Got it.
Um, so there's different grades of scoring there that indicate whether you should get a sleep study or not. Okay.
Got it. Awesome.
Yeah.
So, Dr. Downs, let's say I'm in Greensboro, North Carolina here, and I wanted to bring this program over to our community. So, how would I go about finding a dentist who is a really good complement for us to do this? What requirements are we looking for the dentist, and what requirements are we looking for a chiropractor in order to bring this
Mm-hmm.
revolutionized system to our community?
No. Well, first of all, I would check the yellow. Shows you how old I am. Yellow pages. I'd check the internet, and you could see whether the actual dentist treats sleep apnea. They will often advertise that on your website.
Okay.
Many dentists don't treat it,
Okay.
but all dentists have been mandated to check for it by an ADA recommendation in 2017.
Okay.
But not all of them are doing that either, so that's a problem. But
Okay.
yeah, you want to see if they actually treat sleep apnea, and then you can interview them and see how much training they've had.
Okay.
And then the same thing goes for the chiropractors. Now this is new. I'm bringing this program to chiropractors throughout the country. We're going to change. We're going to make a revolution in chiropractic care around sleep apnea. It's a non-invasive, non-drug treatment. It's ideal for what chiropractors do because they're all about wellness and staying out of the medical treatment arena, getting away from drugs and surgeries. And I think that is just absolutely wonderful. And so I think they're the perfect partner for a dentist. And we can help our medical colleagues. We're not here to compete with them. We're in here to help them. We want to be partners with them. And I think the best way to do that is start with the Dental Chiropractic Collaborative in treating sleep apnea. And by the way, there's over 100 forms of sleep disorders in the country, but the vast majority, I'd say 98% of sleep disorders are obstructive sleep apnea, and that is what needs to be addressed. It's uh, the other more specialized forms of disorders. We're definitely not going to treat that. We're going to let the medical profession take that. Also, the area of insomnia, we can treat that as well. insomnia, obstructive sleep apnea are the bulk of the problems.
Absolutely. Absolutely.
Yeah.
Did you want to add anything else? Have I forgotten anything else that you'd like to share with our audience today? And
Well, I'm actually thrilled that I'm dealing with a pediatric chiropractor who is going to help children. Really, dentists can and chiropractic, we can treat a child so that they grow up never experiencing sleep apnea. For the rest of their lives, they can be permanently cured. The medical profession is not curing anybody. We can, you and I can cure these problems, especially for children. And so I'm absolutely thrilled to be working with you, Dr. Alex.
absolutely. I'm so excited that I had an opportunity to meet you and
Yeah.
foster this relationship and see where this goes. Because I think
Yeah.
we owe it to our communities for them to know that there are options available, and
Yeah.
also to inform our medical counterparts that we do have different things in our bags that
Yes,
will
that's right.
enhance their outcomes for their patients as well. So I think overall we just need to work a little more in sync with each other and have a good conversation amongst each
Right.
other and say, this is what I can do, this is what I can't, and this is how I do it.
Sure.
And not step on each other's toes, but actually just enhance the overall outcome of the patient. And I think we all took the oath to put the patient first. So
absolutely,
we owe it to the patient to show them that it's possible to not have dysfunction and disease and discomfort as we age, right?
That's right. That's right.
So I want to thank you for taking the time to speak with me. I am looking forward to being an observer and a participant in your revolutionized journey. And I am so thrilled to have these conversations with you. So thank you so much. And anything else?
Oh, that's it. I appreciate this.
Awesome.
I look forward to
Fantastic.
talking to you again.